Can I travel on an airplane with both CPAP and oxygen therapy equipment? Have you ever wondered if you can take your continuous positive airway pressure machine and oxygen therapy equipment on a flight? The good news is yes, you can. However, there are some important steps to follow to make your journey smooth and stress-free. First, let's talk about the continuous positive airway pressure machine. This device is considered a medical tool and is generally allowed on commercial flights as a carry-on item. It does not count toward your carry-on baggage limit. Most modern continuous positive airway pressure machines meet the safety standards set by the Federal Aviation Administration, which means they are approved for use on airplanes. To avoid any hiccups, it's best to notify your airline at least 2 weeks before your flight. Inform them that you will be bringing your continuous positive airway pressure machine and may need to use it during the flight. Often, a doctor's note or prescription confirming the medical need for the device is required. When you go through security screening, you will need to take your continuous positive airway pressure machine out of its carrying case for X-ray inspection. However, the mask and tubing can usually stay inside the case, making the process a bit easier. Now, let's discuss oxygen therapy. The Federal Aviation Administration allows the use of portable oxygen concentrators on flights. These devices provide supplemental oxygen to those who need it. However, liquid oxygen is typically not allowed on planes, except for empty units that can be inspected. It's essential to coordinate with your airline ahead of time to confirm their specific policies regarding oxygen equipment. They may require medical clearance forms or other documentation. Just like with the continuous positive airway pressure machine, oxygen equipment is usually carried on board and not checked in with luggage. When traveling with both continuous positive airway pressure and oxygen therapy equipment, keep a few practical points in mind. First, airplane seats often do not have power outlets. So, it's wise to bring extra batteries or portable power supplies for your continuous positive airway pressure machine. This ensures you can use it without interruption during the flight. Also, remember that airplane cabins are pressurized but at a lower pressure than sea level. This reduces available oxygen, which can affect individuals with sleep apnea or lung conditions. Therefore, having supplemental oxygen may be necessary for some passengers. Planning and communication with your airline are key. Reach out early to understand their specific policies regarding both continuous positive airway pressure and oxygen equipment. This includes any forms you need to submit and procedures for boarding and in-flight use. Lastly, keep your documentation handy. You may need to show proof of medical necessity if requested during security screening. Using your continuous positive airway pressure machine during air travel is important for managing sleep apnea effectively. It helps prevent apnea episodes caused by changes in cabin pressure and oxygen levels. For some patients with additional respiratory needs, combining continuous positive airway pressure with supplemental oxygen therapy is essential. Airlines are generally accommodating to these medical devices, provided you plan ahead, communicate clearly, and carry the necessary documentation. So, pack your equipment, stay informed, and enjoy your travels.